The treatment options for urinary incontinence, the non-surgical options, are medications like I discussed before, estrogen, anti-muscarinic medications. There's quite a few of them to help. It's not necessarily always successful, and sometimes there's high doses, and there's a lot of side effects that comes along with any kind of anti-muscarinic medications like dry mouth and some various other side effects that people don't usually particularly enjoy. A pessary. Pessary is a little device that is inserted into a woman's vagina that helps any kind of a prolapse, and sometimes that prolapse creates urinary incontinence. So the pessary will sometimes really help decrease that urinary incontinence. However, the pessary can be uncomfortable. A lot of women get very self-conscious about it, and if they are sexually active, they actually have to be able to take out their pessary to have intercourse, and then they have to be able to put it back in. It's not extremely tough, but if someone is elderly or if they are overweight, it's definitely harder to get the pessary positioned in the correct position. And also there can be sometimes side effects with the pessary would be like an abrasion in someone's actual like skin breakdown in the actual vaginal canal. The Kegel exercises, like I discussed before, are great options. Just sometimes people do not understand how to do them, and they would either have to get the physical therapy or learn how to do them correctly for them to actually work. Biofeedback and functional electrical stimulation, which is what I talked a little bit about. It's actually very painful, but with great results. There was a comparative study in the research done that compared functional electrical stimulation and magnetic stimulation, and they both had great results. Functional stimulation is just extremely invasive, painful, and most patients do not care for it. Magnetic stimulation is not painful and it's non-invasive. So that's why that's a great choice. Urinary incontinence is a significant medical problem that needs to be treated to increase the quality of life in women. The focus of this paper is to identify if magnetic stimulation decreases urinary incontinence in women. In addition, this presentation will propose an evidence-based intervention aimed to increase awareness of magnetic stimulation to treat urinary incontinence.